In this session, we'll start with a keynote talk from Professor Aura Conci, who is a professor in computer science department at Fluminense Federal University, Brazil. Professor Aura Conci has more than 400 publications with an overall citations crossing 5,500. She is a renowned researcher known for her contributions to the use of AI and imaging for healthcare diagnostics, specifically improving techniques for early disease detection. If you are working in breast imaging or thyroid imaging, you must have used open source datasets from Visual Lab. And I'm proud to say that Professor Aura Conci leads the Visual Lab at the university, and she's a key person in open sourcing these datasets. With this, I invite and welcome Professor Aura Conci for delivering a keynote talk at AIIMA 2024.
Thank you very much for so nice words, and thank you very much for this invitation. What I want to, the point that I want to think about, or better, to put you to think about, it's why you are using artificial intelligence in this topic, infrared imaging. I know why I am using and why I think this is so interesting. But when I see, please, you can pass to the second one. But, and also I am very, very proud to be here and to see that there is some applications from the first keynote that continues in a subject that's very important for me, that breast cancer or breast investigations, and it's going to the last talk, when you see that it really there is a lot of place for new applications. So let's think about the difference, or why. Of course, I know that you know that each type of imaging have special particularities. For instance, most of them, the first one is the X-ray. Okay, this the third. Okay, go to the next one. Can you move, Steve? Thank you. Okay, the X-ray is probably is the first type of internal image that you are that you can use, and the medical doctor can be using for see the inside of the body. The X-ray is very important to see the interior of the body. And it can be now see a tomography, computer tomography, or in case of the breast, it's the name it mammography. It's a way to see the inside, the masses inside. Of course, it continues to be very important for all of disease. But there is other type of imaging. The X-ray put, as the name is, the CT of mammography. They put X-ray in the body of the person that is on examinations. Okay, Siva? Another very important type or other type of imaging is the ultrasound. The first keynote, the first talk of today also mentioned the importance of ultrasound for breast and for any of the part of the body. Ultrasound is a different kind of imaging. There is no problem for the body. The people of any age can use it, of any health condition. But it also puts something in the body. It put the sound in a different frequency to see what is the inside, and is a way to see the inside of the body. The next one, please. Silva? 5. Magnetic resonance imaging appears after. And magnetic resonance imaging is very interesting because it's not only an anatomical imaging, an anatomical way to see the inside. It could be a physiological way if they use contrast. And the point is that also it's possible to eat the interior of the body, but in this case, you put the person in a magnetic field and see what is the difference of time of the time of each tissue to enter or go out of this or this resonance with the magnetic field, and so see the difference of behavior of the body. It's interesting to have a special application as all any time of the image. Scintillography is much more similar with thermography. Scintillography is a physiological examination from the beginning, as thermography. And it's a way to recognize, it's very interesting and because like PET scan that the first keynote mentioned, is a way to recognize metastasis, is a way to recognize if the cell of some kind of cancer have migrated for another part of the body. So it's only work if the people is living, for this is a physiological examination. And as another physiological examination, the image is not so sharp. But it's very interesting, and you have to put this injection of contrast, and the machine see this gamma ray radiation after this injection. And so on. You can use PET scan and any different other kind of imaging. 7, please. So each time of imaging have a special way to do some acquisitions. Some of them, more of them, I think that all of them except infrared, in the fact, put something in the body that is on examination. Infrared is the unit that do nothing in the body. They have no, they only acquire the infrared radiation that have natural production for anything that is not on absolute zero, that have some motion, something, some kind of internal temperature different absolute Q zero. Produce some any radiation that being captured. So there is nothing that you put in a body that you are on examination. This is a very good point, as the first talk of today mentioned. The point is that one of point that you need, of course, like all of the other, you need a special sensor or special machine to acquire this. 8, please. Because the infrared energy of the infrared frequency have a different frequency, and if you consider that the frequency is opposite to the wavelength, that is important for us because we understand a visible imaging, and X-ray or ultrasound is not visible, of course, but also infrared is not visible. The point that is infrared has wavelength greater than the visible light, and for this frequency less than the visible light. And our eye don't see, but you can capture naturally as you capture any photo, any movie, anything with your cell phone. So you don't have to put nothing to capture this infrared. Okay. 9, please. But of course, there is some interesting aspect. You have to have this special camera, and you have to have some migration from the surface that is producing this energy, or have the interface of the surface from the body that is on examination to the camera. It's travel from the air in this kind of camera that everybody presents something today until now. So the camera, sensor don't touch the body. The sensor capture the radiation from the body. So it have to travel from the air, from the environment, but also it has to travel from the interior of the body to the exterior of the body. And you have to consider some special elements in this travel, not only to transform the radiation in temperature that is okay, it have some complications, but it's an equation, and introducing some factor like emissivity of environment and other details of the environment and the surface and the body that is traveling, that energy is traveling, is possible to find the temperature. Okay, 9, 10. And of course, when you can acquire this energy, is like any other type of image, you transform this energy or this information in something that can be visible or can be represented graphically. And this is thermography, the graphical representation of some energy in the surface that is captured and is transformed and in some way in temperature. And the point is you can see it as a graphic because it's easy to understand, of course, like the X-ray, like CT, like MRI, like ultrasound when you put it in visible in a way by the computer that is turning the image. And also, in case of demography, sometimes it's interesting to observe the variation of the body during the time. And for some applications, this variation is very important. And sometimes it's very important to acquire when you prepare the database. But in the end, thermography is this acquired energy transformed in point temperature and showed in a way that you can use the computer to interpret it using some kind of image processing techniques, or you can interpret it without computer if you were a very good radiologist, a very good medical doctor that have some training to interpret it. 11, please. And this thermogram, of course, in some case, you can transform directly the difference of temperature of the different energy in each point in something that is visible, like it is gray images, or you can, to improve the interpretation, especially for a human eye, you can use a different kind of false color because in a way to group better some information. In the first line, you see 5 images in different directions, but it's in this case is a breast example. But you can the informations that you will see, you can decide for the lower range to the upper range and put it as a grayscale. But you also can decide to put in different shade of colors for better interpret these. For instance, in the lower part of this image, in the second palette, that is the name dark blue palette, you can more easily see something inside because the green shade looks more different of the yellow shade in the neighborhood. So it helps you to see some aggregation of temperature. So sometimes the use of, especially for human visualization, for human interpretation, for radiologist interpretation, only using the visual without the computer, this makes some difference. But of course, for the computer, it means nothing. The important is the data. These different shade of colors, of course, for some type of interpretation, it is relevant, but it's only a decision about which color you put, which range you put in each different color, and how do you see. Okay, next one. But another point that maybe is much more, causes less impression, but maybe is much more interesting, what is the appearance, is that you want to see what is inside. But thermography, different of all other type of image, you only have the information of the surface. Is the surface of the body that is captured by the camera, and there is a surface of the body that uh, could be identified by the camera and transformed to an image. But what's the medical doctor want to see? They want to see the interior of the body. And they want to see something inside that produce the difference of temperature and travel to the surface. And the only thing that you have to have some clue, some type of to help the interpretation of the inside is the outside. And in this travel from the inside to the outside, of course, suffer when passed from one tissue to the other tissue. And but sometimes this is even not the point, that they suffer the interference of the veins and other elements that produce more or less refrigeration. Some part of the body have different kind of tissue that transmit better the temperature to the other point than the others. For this, is used for all other type of imaging. This is used for X-ray, for MRI, for the ultrasounds to show the difference from one tissue to the other tissue. But the point is, please, 13, next one. The point is that in thermography, you really want to see the interior, only have the interior, the exterior, but want to know the interior. But of course, thermography have important characteristics, important aspect, and these have to be used in favor of thermography, especially from the beginning, when you decide to do, for instance, the protocol for acquisition in a database. One of these examples that is very in favor of thermography is that even reduce a number of cells, reduce interference, can increase the temperature, and even a small number of cells change the behavior and can be captured outside. It's very, this is a very in favor of early detection for some part of the body, because even something that increase the number of cellular productions, increase the temperature of a region, increase the energy of a region, and can be captured. And also another point is that some kind of other elements that this cellular multiplication produce, that is a lot of fluids in a region, in the end produce other vases or the other vascularization and increase of fluid in a region. This increase or change of fluids in the cells also promote the construction, the creation of new veins, of more veins, more weight for these fluids be eliminated for the vein, and also increase the necessity of food for these cells to increase these multiplications. But these veins, the new veins, most of the time have not the same characteristic of the normal vein, of the normal cell that from the creation has the destiny of a vein. The vein that is original or created from the beginning as vein have some case that in most of the cases have waves that some kinds of construction inside these tubes that in the end a vein is a tube that is against the motion of the fluid against the direction that they have to go in on. So the new veins production by the angiogenesis, this increase of the cell, the increase of cell growing, there is not the same behavior of the normal vein. And this also improve the temperature of this region. 14, please. And this example show this aspect that of these neovases, or what is named neoangiogenesis, that is the formation of new new vase can produce. When a cell begin to multiply more than is expected, that is a tumoral cell, it's increase the produce. It need more food, of course. They try to access more the veins to have this food, but also they as everybody that multiply, they also produce some kind of garbage. And this garbage is in a lot of time is fluids. And so the fluids in the region increase terrible. It is increase of fluids produced by the cytosines and chemosines, that is the waste of the cell. Also produce more vascularization in this region. And so this can be captured from the camera from the beginning. In the beginning of the formation of this very huge multiplication of cells. And is a positive aspect for demography and detection, but it have to take in consideration when the database is production. This is an example of this for when we are constructing the database for identifications of malignancy of thyroid nodules. Because we want to see what happens inside by demography, but we only have the outside. So the physiologist, the medical doctor, know where is the nodule, but they want to see if there is possible to see if this nodule is benign or malignant, also how activated it is, and how is the production of these new vases around this nodule, to see that it's possible to identify if it is a malignant or a benign nodule. Okay. So in sometimes it's different to remember, and you have to remember to the patient, and especially to the medical doctor that is our partner in the research, research, that as another type of imaging, it has some particularity. But the point that is especially in infrared use or thermography, is that you capture the surface, you capture the outside, but you want to have some cues. You have to have some diagnosis, some point of some issue that is inside. Okay. And this is not, it is not a kind of only temperature variation. Sometimes, as a person mentioned, how is the temperature of a nodular point? And some kind, if you have access exactly to the nodule, to the tumor, to the benign or malignant cancer, you can see what is the temperature, but this is not the point. The point is how it is in the surface, this part of the internal body appear, and how it's travel to the surface. So this is an example for this interpretation of how happens in this part of the body that is related to the neck of the person. Have some refrigeration, that is refrigeration of the inspiration and expiration that's produced by the trachea, and have the change of temperature of the skin and the environment of the room. But the point where there is a great increase in heat in the region is related to tumor, to the issue that you want to see if it is malignant or benign. If you want to see how it's big, for instance, you can see that these produce some difference in the surface. This difference in the surface, of course, is related to a lot of parameters, but you can see that there is some difference. But the point that this difference is sometimes very particular for that person. Even if you put all of this point, this reduction of all this variation, it's not something like fixed, as you say. It is increased 3 degrees for everybody, or it is increased a half of degree for everybody. It's not so easy. It's very particular and have to be observed, and most of the time consider one side of the other side of the same body of the same person. Next one, please. And so this is the importance of sometimes do variation in the temperature, or sometimes do refrigeration, a cooling of an area, and trying to see the behavior of the same part of the body related to this cooling. And for this, most of the time, it's interesting to use not only one axis, but see the difference of the behavior of that point in the variation, in the answer to that cooling. How it is, this answer is very important to see how is the behavior and how much is this vein, this new vein that is formed around the important point, or the point that you are studying. Okay, next. So another point that I think that is could show you the importance. Let's return into the one of the first applications of thermography, that is for breast. Of course, it's related to this very specific change of temperature, very slow change in temperature that can be captured. It's very interesting for early detection of cancer. But another point that is interesting, nowadays there is a lot of treatment that we want to see the answer of the cancer. It is a cancer, it is a malignant tumoral or malignant increase of cells. And but before the surgery, it is interesting to see the answer of some kind of treatment, treatment that can improve the chance of survival of the patient after the surgery, for instance. So the adjuvant treatment is very more related to any kind of patient. And one of the important points is see how it's behaved after some time. So another important point is see if after the treatment, the tumor reduced, the tumor is encapsulated. And okay, that's nice. Thank you, 21. And this is another point. Sometimes you see if it is increased or decreased, but depending on the point, even in the breast, you can see sometimes you can see that this reduction affect the exterior, but sometimes not, because even the breast, there is a lot of elements that you have taken consideration. Next one. This is an example of one point is numerical experimentation. Another point that you have to take care in consideration where you see that a data set or a database don't have all type of cancer of all type of number of cases that you want to see is perfect for the computer side of the uh, artificial intelligence aspect of view. If you have a big data, a big number of data for all type of any possibility of any disease. But another point is that you can have all type of problem if you don't this thing experimentally or numerically. But it's impossible to force a person to have this kind of cancer or this type of cancer or this type of answer because a cell is a living thing. A group of cell is even more. And a group of different type of cancer is impossible to see. And even in the same type of cancer, in the same type of organ, if you have every details very well considered, impossible to determine that this will be the behavior of some organ or some cells. So, okay, next one. So, when you are considering that the things that is the subject of your study is a living thing, this could be a cell, this could be a cancer, this could be a woman thing. You have to use what is presented to you. This is an example of a simple examination of the breast cancer that that could show you for you that even this interesting thing that you can to see how is the size of a tumor inside the breast, and you can see by the mammography and the thermography, especially the thermography that is the subject of us today, that there is some kind of asymmetry that is very interesting in this thermogram. Do you see that the nipple with one side appear as a cooler region, and another side it's disappear? If in one side of the breast is disappear, oh, it could be related to something that is behind the nipple. In this case, is a carcinoma that is behind the nipple. We want to see. And it's possible to see that this produce some heat that make the nipple disappear in one of this breath of this person. But this happens because this is of some size and some depth. It is cancer is breast is reduced or is more inside. It will be continuously possible. So even in a breast that is have a lot of structure, but it's not so difficult, not have so different kind of refrigeration of only the veins. It could be almost impossible to only decide easily. You could see that it's difficult really to use or to have some, okay, that's okay, 24 hour. It's usually is very, very complex to decide only visually because you can forget some detail. So it's very important to use the computer for this, and it's very important to use, I think that is very important to use all recurses are possible for it. And in case of artificial intelligence, of course, the first step probably is the detection of region of interest because this reduces the possibility of false positive and false negative, and so your index in confusion matrix will be better. But okay, there are next one, please. There are a lot of other steps that you have to use in favor to not promote false expectation or false result. For instance, is if you group some results, if you group some kind of information related to temperature, make in a pre-processing, for instance, I'm joining some small temperature. Because if you have difference of temperature, and it's a computer that it uses it, you can really increase it, changing the scale of something like that. But you do some kind of use that you join this temperature or join this aspect, or do not from the beginning see the different of texture, the different of aspect, you'll really lost of the possibility to see this information. Okay, so this is the point. Of course, you need a lot of data, and if you have more data and if the data is balanced, it's very interesting and very important. And but you, in any type of in any point of research, you have to remember that when you are using, okay, next one, when you are using a living thing, it's you don't have to show what is the behavior of this living cell, of this living organ of this patient. And of course, there is also case where only visual information, you don't need too much of the computer. You probably don't need artificial intelligence for everything. This is an example that not are using in my medical school, that they are using a thermography for see if the people on surgery of the brain surgery needs to have more tissue retired or taken out from the brain or not. It's an example where the surface that the camera is capturing don't is directly in contact with the air, so there is not too much things to model in the surface. Okay. Next one. So for a real-time diagnosis, you don't have to use any computer in, or have to use complex tool for everything, but you have to choose what is the correct points or the correct aspect that you have taken consideration in each step of your research, in order to don't produce false expectative or don't produce false results. Next one. So the things that I want that now using thermography for medical application, that each step is very important. You need to have more data available for everybody to share and to do his research. But this data, of course, need to have a correct acquisition. You have to think about the protocol, about the ethical committee, about the points in favor of against that things that you are producing. Of course, the computational aid in diagnosis is very important. Of course, the 3D modeling, 3D understanding the 3D and understanding all the aspects involved, like the anatomic point of that body is very important. To construct better model, to construct better argument, to understand better each step of the problem. And another point that I think is very important, and I have to thank very much for the group that are organizing for the third type, this organization, this conference, this organization's conference, is that the cooperation is very important. So, okay, thank you very much for the opportunity. Next one, Siva. Thank you very much for the organizer for the opportunity. And I want to tell you that it's important the cooperation really is continue to work with thermography. I don't know why you begin to use these, but continue to work with this, because it's a very interesting point, and each time you have a new different aspect to work and a new aspect of image, could be served as a very nice instrument for your diagnosis and for all the others human beings. Thank you very much. Thank you, Stephen, and thank you
That's very good to hear, Professor
for you for.
Conci. Yeah. So it's a wonderful presentation covering our experience and insights on the use of AI and infrared imaging for medical applications. So we'll just take the questions from the audience. I think the first question is from Dr. Geeta Manjunath. What is the cooling protocol do you suggest for thyroid imaging?
Yeah. When I begin to when I in the beginning when I uh, they hi Marcus, how are you? I'm seeing you now. When we begin in a type of research, for instance, 10 years ago, when we begin the research of breast, we tried to see all elements. The first you model this part, and you talk a lot with the person of our medical school. Thanks God, our university have a good cooperation of all the persons in biologic side, especially in medical school, and we talk a lot of them with them, and you do a lot of experimentations because sometimes you read other works, you make a review, make a survey when they mention, you don't have to put cream, you have to use a gray room, you have to put refrigeration in the room, it's better to refrigerate with alcohol the surface. You read a lot of things. And my formation as a research is that it's difficult to see what point is really only a compilation of previous work or it is really a new aspect. So the first thing that I think that every new student I have, even in the undergraduation class, every question, every point, every aspect, have to think twice, 3 times, 10 times more, because a new point of the view can change everything. So the protocol that I use for each part of the body that you are studying, you make with a lot of research and you try. And each time you see a different investigation, a different cue, a different way, you try to see if that happens or not. I am in the previous before, it is a lot of fake news that now appear. But from the beginning, I'm always don't believe in the belief in the first time and the first opinion that in science, like every other things in the human being life. Sometimes you repeat the things that previous one have done, and you really don't put the question: Is it really? It makes sense, and sometimes even when it's looked at, it make all the sense. I think that you have to investigate because a little change, a little change in any aspect move everything. So, Marcus, very nice to see you, again, even by the computer. And we're now using a protocol for each part of the body when I go to, but from time to time you try to change it completely. So you have to, I have to talk with you carefully about what you want to mention about some detail, because I'm not completely sure of anything of this one is good. But when we see the equations, when you see that the change on time and the change around the variations around the surface, and this is very important. When you see this in kind of heat transfer of the modulation of the human part of that body, you try to introduce in the equation, you try to do first numerically but this is easy. You use some not so easy. Sometimes it's very difficult to know all the parameters, but you can't force numerically or experimentally some behavior. For human being, it's impossible to force anything. And the behavior for the cooling or for the heat for one person is not the same. It even is not the same after 6 months. So is some the richness of detail of one cell, of one body, of one organ. It's fascinating. It's for this, I think that physiological imaging is very interesting to work about.
Okay, that's very great to hear, Professor Conci. I think one last question from my side, as you suggested, like when we capture these thermal images, every time you capture, the temperature value changes, right? So
Yes.
how do you,
Uh-huh.
like, as a researcher, how do you handle those scenarios? Like, how do you standardize? Any thoughts on that?
We try to when you decide you investigate, you take a number of volunteers from time the number is bigger than, and try to do this. When you decide this look true, this look that we work efficiently, you decide to have a group that is really, it's follow a standard, it's follow a pattern. So if you change a lot of elements, it's impossible to have some conclusions, Siva.
Okay.
So it was but from the beginning, you choose 20 persons and try to decide for a pattern, for a standard, for a protocol. Yes. Hope,
Okay.
hope is it.
Thank you very much, Professor Conci. It's an honor for AIIMA to have you as a keynote speaker in the third international conference of AIIMA. Thank you.